We have a training coming up in actually at Dr. Siegel's clinic and at her event center. Yes, she has an event center right like 20 feet from her clinic, and it's big and impressive, and it's waiting for us to come. And I was supposed to reserve it a while ago. I got sent the contract, and I just today signed that and paid what I was supposed to, I don't know, a while ago. So I'm sorry about that, Dr. Siegel, but we got it done. And so we're looking forward to that. It's, again, because of COVID, it's 100% refundable if you decide you can't come. And I just booked my tickets, and a lot of that's the same thing. They're having a lot of grace for people as far as canceling and rescheduling and all that. So that's kind of nice. So on-site $6.99. Live stream, though, we're going to have a live stream professionally done there as well. That's available for $3.99. And so if you can't make it, you can sign up and you can just really work alongside of us. We're going to try to make it really interactive, even for those who come in through live stream. So we're going to do our best to involve you in this training and to get you on the path to being an ozone, an expert. So there's a lot. These are some pictures actually from Dr. Carlson's clinic. So you're going to see this was a dog there, and there's a lot of pictures that I put on here from that. So this was a little bit of our experience recently, but you're going to get hands-on. There's notes and resources and different things. There's an experienced instructor, at least in Dr. Siegel, and we want you to become an expert. We want you to be somebody who's prepared and who goes out and starts using this. And again, these are some of Dr. Marlene Siegel's and Dr. Margot Roman's cases here, but everybody has those tough cases that they just don't know what to do. And so ozone therapy will be an important tool for you to treat those. And we want to help you get on your way to that. So come and join the community and get trained. All right, so that is that. That is the, I don't know if it's the boring part, but it's not as exciting part. It's exciting for me, but probably not anyone else. So we're going to move on, and we are going to jump into this. So I have, again, just to really briefly want to introduce Dr. Carlson here. So I think one of the really cool things that I noted, and I'm going to let you introduce yourself in a minute, is that you grew up and you actually were in high school when you started working at the clinic you now own. Isn't that right?
Yep.
So that is a really cool thing. I see you went to Purdue, you graduated in 2002, and you began as an associate there at South Lake Animal Hospital, and now are the owner, and that's really neat. Tell us a little bit more about yourself and what you do.
Yes, so I graduated 18 years ago. It feels a long time. I joined the practice that I'd worked at in high school, and it was strictly conventional. So I did what I had to do, conventional, and then once I bought it 5 years ago, I started my holistic training, and then it's been holistic for the last 5 years. I'm certified in acupuncture, Chinese herbal, Chinese massage, almost chiropractic. I'm sure there's others, but I've taken a bunch of classes in the last 5 years just to have a very, very good knowledge base on integrative medicine.
Awesome. So you got started in conventional medicine, you say. What was there a moment where that changed, or was it a process? Kind of where you...
I wanted to do holistic when I went to vet school, but the guy that I worked for was very conventional, and he told me that holistic medicine was voodoo medicine and snake medicine and all that good stuff. And so I didn't pursue it. And then I went to a seminar 12 years ago, a conventional conference, and it was actually Instinct Variety Raw Food. And they did a lecture about chronic problems, chronic ear, chronic skin, all these issues that could be solved with raw food. And it just made sense. And so I started raw feeding, and that's kind of how I ended up in the holistic medicine. Once I started raw feeding and recommending it, then it just made sense to go more holistic. So I am integrative. I do conventional medicine and surgery, but I like holistic medicine because it gives me a lot more tools in my toolbox to be able to treat my patients. When conventional medicine doesn't have an answer or doesn't have a treatment, I have lots of other options with holistic.
Okay, so here's a question that I didn't have in our, in there for you, but I'm going to hit you right off the bat anyway, because it's always something that I wonder, and maybe both of you can speak to this really quickly. It's now and then I'll have the veterinarian who has trouble, considering adding a new tool into the practice, and that's actually fairly common, I'd say, because they already have a number of things. When you're conventional, it's more along the lines of why we're either gonna, use some sort of drug, pharmaceutical, or we're gonna do surgery. And then you open up Pandora's box with the holistic treatments, and there's a lot of different things that you can use as well, in addition to those things. So how do you decide when it's enough and whether or not you should add another treatment to your practice?
The biggest determinant for me is if I have a patient and I don't have a tool to fix that patient, then I look for another tool. And ozone was one of those things. I had a dog that got attacked by its housemate. They were Chessies. They tore each other apart. I mean, this dog had, wounds from one side all the way down to the side, so no skin. And I was trying to treat it, and I was like, I don't have anything. I need ozone. And so that's kind of what brought me into ozone, because I was like, if I had ozone, this would be healing a lot faster. We were managing all the infections and trying to get it to heal. And I just knew that there was something else I could have done. And once I saw that patient, I was like, I'm getting ozone.
And I think it also goes to the old saying, you know what you know and you don't know what you don't know. And if we're so close-minded and we're so stuck in not moving our cheese, there's a book called Don't Move My Cheese. When we open ourselves up to being able to receive more and learn more, that's when we just see miracles happen. So it really, it's that mindset for us. I think all of us have had an experience where we had that case where we needed another tool, and it caused us to go outside of our limited training and find more stuff. So to Dr. Andrea's point, when a doctor gets a case and they just feel like they could have done more, but they don't know what that is, you know what you know and you don't know what you don't know, that's your opportunity to be able to be open-minded and just look for another resource.
Good. So we might as well right now, I mean, probably most of the people here have seen you, Dr. Siegel, but why don't you give us a really brief introduction to who you are as well, even though we've done that numerous times here.
Thank you. Very briefly. So I'm pushing my 40th year in practice, and I made my shift about 20 years ago when I was told by equine practitioners that there was nothing more they could do to save my horse. And my horse had saved my daughter's life. And that was my impetus for saying, no, that's not an acceptable answer. Just because you don't know what can be done to fix her doesn't mean it doesn't exist. And that set me on a trajectory. And everything I learned, I used it in my practice. And it's just become this whole snowball. So now I think we have the most expanded toolkit in the entire world. And everything from ozone to hyperbaric to light gem therapies to salt therapy. I mean, it's extensive to the point where we're getting ready to open detox centers, which of course includes ozone, and they will be worldwide.
That's awesome. One of the things I love about Dr. Siegel is she's always got something brewing, and it's invigorating, I guess, and motivating to be going out and to be doing that. Although sometimes I will say it's also tiring to watch.
Jonathan gets tired listening to all my projects.
and your wonderful daughter Alyssa, who is your sidekick there, always with you, helping you actually make everything happen. So I mean, good team there. But so great. Let's go ahead, and I want to. So you told us a little bit about your thoughts on how you integrate a new tool into the practice and why you needed ozone. You mentioned this case. Where did you hear about ozone? And you also, I don't want to fail to mention that you also added ultraviolet therapy, the UBI, into your practice as well at the same time, and are using those tools in conjunction. So where did you hear about these things, and what was your first what was your thought process? How long did it take you to get to where you were like, yeah, this is valid, it's something I need?
It was about a year ago. I have a client that brought in a ozone machine that was probably 40 years old, and her dog was having respiratory issues. And she's like, I had a dog that had this before and we used this machine. And she brought me this machine and I was like, what do I even do with this? So I had to figure out who it was made by and call them. And it took several phone calls, and I tracked it down, and they gave me a manual on how to work it. And we got it working, and we used it on her pet, and then she used it at home. And it helped. And I was like, I don't know, this stuff's kind of crazy. This client's kind of crazy, but this is working. And so that's what opened my eyes to ozone. And I knew that it existed. And that was a year ago. So I hadn't done anything about it. And then when I got that one case, I was like, I think I need to get that ozone machine. So not her machine, because hers is like 50 years old. It came in a like big wooden thing. I mean, it's huge.
So
Yeah.
can I ask a question? So there's two types of personalities in our field. There's those that dip the toe in and they kind of go and tread slowly. And then there's those that just jump in with both feet. Which one would you describe yourself as?
Jump in with both feet.
Yeah, I thought so.
Yeah.
I have lots of irons in the fire too, just like you.
And there's nothing wrong with that. And I actually brought that question up for those people who are more of I need to dip my toe in and just try a little bit and see if I like it, and then I'll expand. And that's fine. You can do a ton of stuff with that. I'm a jump in. I talked to Jonathan for 5 minutes when I bought my machine, and I said, I want one of everything. and he went, well, that's the easiest sale I've ever had. I mean, really, it was what, $7,500. It was, I want it now and just ship it all. It was
Right.
It was easy.
Yeah, every client should be like that, by the way. Okay, so that's cool. So you've had this now. When did we come down and do the training? Was it like a month and a half ago?
Yeah, I would say 2 months at the absolute most. Yeah.
Okay. Yeah, that's what I was thinking, somewhere around there. So tell us a little bit about some of the challenges and maybe, well, let's start with some of the challenges. What are some of the things that have been a little challenging to deal with? And I want you to be, again, honest with us here tonight. I know that it's not always easy to integrate something into a practice. So what have you experienced that has been challenging as you've integrated ozone into your practice?
The biggest thing was just scheduling enough time at first when we were first starting to learn. We made sure that we had an hour to an hour and a half for each client. And it took us that long just to figure out what we had to do and how to do it. So that was one of the biggest challenges. The other challenge was because I jumped in with both feet. I didn't have enough supplies in the starter kit. So we ran out of like rectal catheters and things like immediately. So I wish that we had more to begin with. I had to borrow some from other vet in town. And they're probably one of those that they gave me one. They're like, it's kind of expired. And I was like, it's expired? How did you not use it? But that was one of the biggest challenges, was just, making sure we had enough time, and making sure we had all the supplies we needed.
So in regards to learning curve, things like ultrasound, we know have a big learning curve, lasers and all those other modalities. How would you rate learning how to do ozone on the scale of learning curve?
Very, very easy. It's not hard to learn. It was just going through step by step. And one of the ones we did was the major auto
Chemotherapy.
That was one of the ones we did first. And so that one's the one that has the most steps. And so that was the hardest part, was just trying to get all the steps done. I think one of the biggest things that I enjoyed was having my entire staff at the training, because they are my biggest supporters of ozone. My little high school kid that's just a veterinary assistant, she is one of the best ozone administrators we have. She brought her cat for the training day, and I said, you can, yeah, Peyton, yep. She did the ozone on her cat, and she was rocking the ozone machine. By day 2, she had it ready. She knew how much everybody needed. She made us little like cheat sheets that said, you know, how much ozone do you need for this? Even though it's all in your book, it's just like little charts.
Absolutely.
So having the staff on board was really helpful, and it's something that they can do. I mean, obviously, I'm the one that decides who gets ozone and how they get ozone, but they're the ones administering it. So it's simple enough that a high school student can do it and do it well.
So the point we really want to drive home is this is a technician-driven skill. This is doctor time off. You just have to write the script for it. That's really important.
Yes.
So,
and that is a big, big bonus for me because I'm a single practitioner and I'm very, very busy, and things that I can delegate to my staff that do an awesome job is things that I delegate. So
yeah.
Good.
Awesome. So I'm going to ask another question that's just a little off the beaten path here as well. So I'm thinking about the pet parent who you know comes in and they don't really know anything about ozone therapy. For both of you here again, how do you encourage them again that their pet should consider having ozone therapy done on their pet, and why do they need it? What would you say to them, and how did you deal with that initially, Dr. Carlson? There.
I always tell them that it's safe, it's easy, and it's almost miraculous in the results that we see. I also priced it affordable because I wanted it to be something that I could add on to additional treatments. So if I was doing acupuncture, now we do acupuncture and they get rectal ozone. And so we bundled those together because I thought that both would help. And we have the ozone bundled with laser, again, because they're all modalities that fit together.
Mm-hmm.
I'm going to let Dr. Siegel answer the more technical question.
So we do the same thing. And we simply say that it increases oxygen, and everybody gets that. They understand oxygen is important. And we also say it turns on over 200 anti-inflammatory pathways. And those are two really simple terms that they just already know. So that's an easy sell for them. And then the third thing that we do, and you'll be able to do over time, if you're taking photographs and you're doing little video stories about your cases, is then you can give them a library to go to. So they can go on my YouTube channel, or we pull the computer out and we show them presentations so that they can see a visual of a case like theirs, whether it's a skin disease, ADR, vomiting, diarrhea, whatever it is, and then they can relate to that case. So that would be another pearl that I would suggest if practitioners are not doing. Delegate somebody in the office to have a video camera on your phone, a nice camera, whatever. It's nice if it's a 4K because you get better quality these days, but make sure you're documenting, because when you go back and you see that case from beginning to end, like it's having that paralyzed animal that comes in that's walking in under 2 weeks, that is just a phenomenal demonstration to somebody about how well it works.
Mm-hmm. Great. So I'm going to actually do something different here for a second. I'm going to put a poll up, okay? So I'm interested. So I attend, there's one usually holistic conference, the AHVMA conference, and big fan of that every year. And this year there's something called the IVCVX conference, which is a virtual conference put on by the Innovative Veterinary Journal, IVC Journal. That's new. It's the first time they've done it. I'm interested to see how many people are actually going to be attending that one, that conference virtually. So just a quick poll there that I'm going to put up and see whether or not we get much response. So far it's a yes.
Jonathan asked, who has not heard about that conference?
Yeah, if you have not heard about it, why don't you chat that into the sidebar? If you yes or no, go ahead and just chat with us for a quick minute. If you have heard about it, put yes. If you have not heard about it before, the first time you've ever heard about it, type no into the comment bar there. So Dr. Siegel is actually going to be presenting, I think, four different
Four
lectures
lectures,
on
yeah.
ozone therapy for the IVCVX conference. So I'm giving them a little free publicity, I guess,
So
for their conference. But
the conference is free to attend. If you want to get CE credit, it's a nominal extra fee for your CE, but it is really good. And my four lectures, one is on ozone, the other one is on photohemotherapy. And then I have two lectures. Number one is new tools in the toolkit for diagnostics, and then new tools in the toolkit for therapies.
Great. So it's interesting. A lot of no's. A lot of you haven't heard of it. So if you go to the IVC Journal website, and I should pull that, I'll throw it in here maybe in a second after I ask the questions. I don't want to do it right now. You can register for free, and you might as well, right? I mean, you're not paying anything now. I know they have an upgrade option so that if you can't make it to the live session and you want to watch it later, you can pay a little bit, but it's not much. So anyways, interesting. Okay, so I'm gonna take that poll down, and we're gonna keep going here with our questions. So why don't I just ask Dr. Battistella, Mary, I remember you came to one of our trainings years ago, I think, asked the question earlier on this evening, when I have used ozone in a very deficient animal, it seems overwhelming. How do you handle these deficient cases, those that are on death's doorstep, so to speak?
You want to go first?
Me? Okay. Well, I'll tell you how I handle it. I would not choose, I probably wouldn't choose major autohemolytic chemotherapy. I would probably choose a less invasive like rectal, and then I would boost the immune system with acupuncture or something like that. So I would usually do like an acupuncture or laser and then add the ozone in. So I'd give them something and then give them a little extra.
So I think it really depends on the case. And what do you mean by deficient? Are they anemic? Are they dehydrated? I think that leaves too much of an area in there. So we always do our ABCs. You do a thorough physical. You make sure that they're not bleeding anywhere, that they're hydrated, that they're able to breathe well, there's no circulation problems, etc. And then from there, I start with making sure they are getting enough oxygen. And so I don't have a hesitation to use ozone, but I'm going to support that animal with detoxification of their detoxification pathways. Ozone plays such a part in all of those areas that unless they're bleeding, actively bleeding like a hemangiosarc, I have no hesitation to put ozone in there. But we're also supporting that animal with fluids, nutritionally. So it's a whole package. We're making sure their temperature is normal, not too high, not too low. I hope that was a little bit more, because the question was so broad that you have to use your clinical judgment and see what does that animal need. But they always need oxygen, they always need circulation, and they always need to detox. So I don't see any reason why ozone won't play a major role in that. You just have to make sure your patient is supported.
Great. Another question. Is ozone good for arthritis? Was posed here. So I want to answer that one quickly, maybe.
Doc, I'll always let you go first.
Okay. We'll let the expert go second. I think ozone is good for almost everything because it's oxygen to the tissues. So infections, inflammation, arthritis, cancer, autoimmune. I haven't found anything that it's not good for. It's providing oxygen to the tissue so that they can repair themselves and be healthier.
Absolutely. So do you remember the case I presented, Holly? It was a big Great Dane that had horrible skin disease. So she was in today because she's been breathing really hard and panting, and the owner was afraid she had lung cancer or something. So we x-rayed her, no lung cancer. But she is ate up with arthritis. So this dog is hurting every time she's trying to walk, her back, her stifles. So we are going to be doing prolozone and PRP on this dog. and then using laser therapy intra-articular. So I was going to try to make her wait till class, but she's just too painful. So we're going to go ahead and do her. We may do a touch-up on her in a month for class. So I will let you know how that case goes. But that's a great example of a lady who was like ready to say goodbye. She was ready to euthanize this dog because she didn't think we could do anything else. And I said, let's just inject both knees and let's see how she does. So I am doing her on Thursday.
Awesome. Yeah, good. So, okay, I'm going to get back to my questions now. So tell us a little bit about what successes you have had, and maybe you have, a case or two that you want to talk about, but however you want to answer that question, what successes have you seen since you've started?
I've absolutely had no side effects or ill effects from using it. We use it on almost everything. We incorporated it into our surgical protocol. So every dental gets an ozone flush. Every surgical patient, we flush their wound with ozone, and then we use the laser afterwards. So we've included it with almost every patient. Ulcers, eye ulcers, we've had really good success with those healing much faster. Instead of it taking 4 or 5 weeks, they're healing in 2 to 3. Glands, for sure. Anything that's infected or nasty back there, we've used it. I do have a case that was just really remarkable. It's a 5-year-old hound mix that was hospitalized at Purdue for 10 days with immune-mediated hemolytic anemia. And they called my client and said, there's not anything we can do. We can't get your hematocrit above 20%. And they recommended euthanasia. And fortunately, she called before she did that. And I said, no, let's try some ozone. So she brought her to me. Hematocrit was 20. We started the major, see, I never say the rest, major auto chemotherapy.
Good job.
I would just say major.
An easier way to do that is just MAHT. I always MAHT. There we go.
I just didn't want to abbreviate it for people that didn't know. But we started that twice a week. After the first week, we got her hematocrit up to 24%. The second week, we got her up to 34%, and the third week, 48%. And that was just, that was last week. And we started taking her off conventional meds. So it's been a full week that she's been off all conventional meds, and her hematocrit is actually 52 today. And that's awesome. Strictly from the ozone therapy. And the owner is ecstatic. I mean, the dog is, she's running and playing and has energy and thriving. That's awesome. When it was time to say goodbye, and it wasn't. So the only other one I have is we have a lymphoma that I've been treating for 2 years. The dog has had lymphoma for 2 years, treated with Chinese herbs and acupuncture. And it went into her eyes, and her eyes got all swollen, and the ophthalmologist told her it was time. And I said, no, not yet. So we started the major ozone with her as well. And we only do weekly on her because they live an hour and a half away. But her eyes are no longer bulging. They're no longer red. And she's still happy and eating and playing. And so we had used all the tools in my toolbox, acupuncture, herbs, laser, everything that I could possibly use. And then I had just happened to get the ozone about the same time that she took a turn. And now we're, again, 2 months out, and she's still doing really, really well.
Awesome.
Yeah, same experience. We have cancer cures from mast cell tumors to osteosarcomas to squamous cell carcinoma in the nose. We have not just remission, but we have documented cures that are out 1, 2, and 3 years now, and they're doing great. But also, don't forget, it's the ADR dog who they just can't, he's just not quite right, a little bit of diarrhea, a little bit of fever, and they don't have a lot of money. Oh my gosh, just being able to do rectal ozone and get these guys oxygenated, turn on some anti-inflammatory pathways. It's really incredible how much it does. And if you're really not sure what ozone does, please tune into my lecture. And I think you have other lectures where I've done for you, Jonathan, where we really show the power of the variety of different things, from wound therapy to eye ulcers like Dr. Andrea had. We have a little dog in our presentation that was 4 days, and she was 15 years old, so not a good healer, and we were able to get rid of an ulcer in 4 days.
Wow.
Awesome. So Yeah, go ahead.
Someone asked, did we also use the ultraviolet on the hemolytic anemia? And yes, we did. So we did the major autohemotherapy with ultraviolet treatment at the same time.
And I've had several IMHAs, so your story is not unique. It really is the power of what ozone can do.
So Dr. Dreyfus, good to see you're here as well. She asks, tell us a little more about ozone therapy for eye ulcers. Dr. Siegel, I don't know if Dr. Carlson has experienced those yet.
She said she had one.
Yeah.
Yeah, we use an ozonated saline flush, and I send it home with the owner to flush the eye daily. And then we also use laser with that. But yeah, it definitely helped the process heal. I still use Remend. I still used an antibiotic drop. Probably didn't need it with the ozone, but just to be sure. So we still used conventional meds, but we added the ozone flushes in, do them weekly at the clinic and then daily at home, because the ozone at home only lasts about 4 to 5 days.
So we do the same thing. We'll send home ozonated saline in a jar, tell them to keep it in the refrigerator, and just have them dose frequently. We'll use silver. We use a silver hydrosol, and that way they medicate that in the eye as their antibiotics, so you're not having to use an antibiotic. I'll use ion gut in the 3 of them together, and it's remarkable the lattice work that the 3 of them synergistically create. I also had a really good case of a dog that burned her tongue. She bit through an electrical cord at Christmas, and she burned her tongue almost all the way across. It was very deep.
Wow.
And we were able to do hourly dripping of ozone. We did rectal ozone as well, but we did hourly dripping in her mouth, along with laser therapy and silver and the ion gut. And we actually had that dog eating in 24 hours, and her tongue never fell off. I don't mean that kiddingly. I mean, this dog was going to lose her tongue. It was over halfway back in her mouth that she had burned it. And we have videos and photos of that.
Oh.
Yeah, and never used antibiotics.
Wow. So there was a quick question along these lines of the saline. Doesn't it degrade? Yes, it does, Dr. Dreyfus, as you know. But again, if you keep it in a glass container with a Teflon top like we sell on our website, you can keep it cold if it's been well ozonated, and use that for up to, we recommend trying to use it within 3 days. You will still have some ozone left in it at 4 and probably 5 days, again, if you keep it cold and sealed correctly. But we recommend after 3 days trying to get some fresh ozonated saline. If you can't, go ahead and use that stuff you still have, but it will degrade. Okay, so we'll get back to a few of these questions in a minute. But can you talk just a little bit, Dr. Carlson, about maybe some tips, things people wouldn't see or know or think about off the bat? It can be anything. Some tips that you would give somebody who's considering using ozone therapy, just getting started?
I definitely think getting the staff on board, and when you first get the machine, work on their pets and show them, the miracle of what you can do. I also bought a little cart, which is just a little tip. I have a little wheelie cart, and we can take it into each room with us, and everything we need is on the cart. All the ozone catheters, the ozone machine. So everything is right there, and we can bring it and actually show the owner what we're doing. So it doesn't have to be magic behind the curtain. It's in the room with them.
Awesome. That's a great tip. And in fact, so we were down at your clinic. I was with my daughter, one of my daughters, Olivia, and we saw your car, and there was a doctor or two before you who have used that same little kind of cart that I'd seen before. But when I went and saw that and saw how you guys were using it, I'm like, we've got to do that. So we have one that's exactly the same cart pretty much that we're going to be putting on our website for sale with the package, because I think it does make it just a really nice, simple way to move your stuff wherever you need it. And it's got everything. It's got an IV pole. It's got, your ozone, your UBI, your oxygen. So we're going to have all little places for everything right on there. And I think that was a perfect little way to do it. So thank you. But anyway, so okay, great tips. Dr. Siegel, do you have any tips for the new user, somebody who's not thought through all of this stuff? What would you tell them?
I would start by watching some videos. You have a lot of information on your website. I would do some research and then talk to some people who are actually using it and get some ideas on what kind of cases and get comfortable. Go shadow somebody. If you don't have an opportunity to watch the videos and feel comfortable, take a course, go shadow somebody. There's usually somebody nearby you that's already doing ozone. And then just plunge in. It's so easy. It's one of the least expensive technologies, and it has the shortest learning curve of almost anything I've ever seen. So it's a no-brainer for me to say it's just one of the most important add-on tools that you can do in your practice.
Good. So, and I think, again, like we've mentioned already, or my tip, do the training. So Dr. Carlson paid for us to come in and do that. And I think, you know, the people that I see that are the most gung-ho, and we had, I think she might even be on here tonight, but Dr. Deleva Rose, who was on the call a few weeks ago with Dr. Roman, and she all we did with her was a virtual training. So we didn't even go to her clinic and train, but we did a virtual, you know, I can't remember how many hours, but it wasn't that long. Even that, she just started started off the bat, started going gung-ho, and she said she paid for her equipment very quickly, which is very important to be able to, you know, if you're going to run a business, you have to make it profitable. But beyond that, just seeing all of those results. And again, I think the biggest tip that I could give is get the training, take the time to stop and get trained before you try to start just little by little. You limp along, and then a year later you're doing, you know, 2, 3, 4 treatments a week instead of really utilizing it like you could. Yeah,
it gives you the confidence to be able to go out there and practice it, and then learn how to charge. That's all part of the training.
Yep. Yeah. So there's Rose says, yeah, it was 3 hours of training, so not very much. And Dr. Nicholson, yes, we're going to be going over some of the basics. So in our training class, we're going to be going over, the first day will be more basics. The second day will be those Prolo and ozone injections. That will be the primary focus of day 2 because it's more technical. It's more involved. So we'll take the time to look at that more in depth. But we're going to be doing both of those things there, basic and a little bit more advanced on that second day.
And Dr. Rose also did the live training. She was with us in Nashville.
Yep.
And she was very hands-on. So she got a lot of good start right there. It didn't take a whole lot for her to go back.
That's right.
Her and I talked a few times in between and helped her on a few cases, and it wasn't long at all before she was just zooming off with it.
Yep. And I forgot about that. And that absolutely helps. I mean, it makes a huge difference in confidence. So, you know, how did you get the word out there to your clients? You know, was there a combination of things you did, or was there one thing in particular you did to kind of get it going?
We did purchase the advertising kit from O3 Vets, which comes with signs and handkerchiefs and all that good stuff. And then we did do just all the social media, Google, Facebook. We sent out an email. We posted our training day just so people could see that we were learning something. So we just we talked about it way up before you even came. Like, we started advertising in March and April. Ozone is coming in the fall. Ozone is coming. And so we had people that were already interested in it. And then, just getting the word out. And then, you know, once you see somebody, you know, she just mentioned a case, and now I'm like, oh, I have a case that I can use that on. So the more you interact with other veterinarians, you realize that there's even more that you could do with it. So
that's awesome. I don't think I've ever heard anyone say that they were pre-advertising. You know, hey, it's coming. It's like a trailer for the movie coming out. I love
it. Was good
though. But that's really cool. That I think that's again a testimony to you jump in with both feet. You're like, hey, we're going to do this regardless of whether or not it's great or it works. We're going to do it. No.
Right, we're going to do it anyway.
But I think that's really neat, and I think those are the things that get other people excited about it. So great, Dr. Siegel. What would you recommend marketing and that for your clients? How do you approach that?
Well, of course, being confident. You have to be confident yourself. You have to have a little experience under your belt where you can actually talk about this case and that case, and just like you do with acupuncture. You tell somebody about, you're talking about their problem, but then you give them some clinical experience on how you've got another case that was similar to theirs and how the outcome was. So that's very important. Confidence is the number one tool, and people rely on you to be confident in what you're doing. And if you feel very passionate about it, and if you feel like this is going to be the right thing, people will accept that. And then the second part is documentation. And then you can put that, if you have sign-off sheets, you can put some things on social media. You can put it in your newsletter of your own, on your own clientele. You can get people to write testimonials. We do a lot of testimonials. You take your phone and somebody has a good outcome and you say, hey, can I just get you to give me 1 or 2 minutes and say what the experience was? And they're so passionate on how you got to make sure they don't droll on and on and on about the case. But if you help them to get really succinct with the point, say, listen, we got 1 minute to 2 minutes of somebody's attention. What were the big take homes? How sick was he? What did we do? And what was the results? And that is the strongest area of advertisement you can do. They're holding up their baby and they're telling how Dr. Andrea saved his life. Doesn't get any better than that.
Right.
Yeah. And I thought of a couple more tips, and I learned these things from you, Dr. Siegel, and from probably a few other people as well. But one of the things I've seen you do really well, you talk about confidence. And I think the fact that you just take those things and you kind of know how, maybe intuitively, maybe it's through a process of just, trial and error. I don't know all of what goes into it, but you blend, again, these different treatment modalities and these different things together, and you expect that your clients are going to kind of, it's not like, hey, do you want to do this? It's a little, in a sense you do, but, it's more like, this is what we're planning to do. and this is why. And it's not like an optional thing so much as it's this is how we treat this, and I think that's huge.
Yeah, it is. And because it is affordable, we charge $35 for rectal ozone. What are you charging, Dr. Andrea?
Same.
Okay.
Yep, same.
So, I have any case that comes in the door, even if they're on a limited budget, I literally say, this is so important. It's only $35. It's so affordable and it's so effective. Never have a problem with it. Never. So, and remember the silver bullet? Because we were all, I don't know, in my day, Dr. Scher always said, never let anybody die without the silver bullet, and that was your steroid. And so we have a lot of other silver bullets now that are much more safe and much more effective than the steroid. And that's what we should be telling people. Listen, even if you don't know if it's going to make a big difference, you're certainly not going to hurt. And we know ozone has an effect on emotionals. So they're going to feel better, even if it's temporary, but at least we're helping them feel better. And so why wouldn't you do that? Mm-hmm. That's my 3 big selling points are oxygen, turning on the anti-inflammatory pathways, and it helps them to feel better. You don't have to go into much more detail than that. Mm-hmm. I've never had anybody ask me for a white paper. They just want to know it's going to work. And then I can show them a video or tell them about a case, and they're good with that.
And they trust you because you've treated other things in the past and you've never led them down the wrong path. Right. And you're never going to tell somebody, listen, this is a miracle. It's going to cure everything. It's the end all be all. Right. We never say that.
It's just like anything else. You prepare them appropriately. You let them know what your pros and your cons are. You give them a differential diagnosis. Some people can't afford the whole workup. You know, for us, it is my workup is $1,000. If I do everything from abdominal ultrasound, echoes, our VDI panels, full chemistry, urinalysis, x-rays, chest and abdomen, heavy metals, it's $1,000 workup. Not everybody can afford that. So we offer, but we work within the people's budget. And you don't do that kind of a workup for a dog that's coming in with an anal sac infection, right? You temper it with how sick the animal is and their age and their history and all that. And then you put together a good diagnostic plan. And I think that's one more point I'd like to make is that we don't want to use ozone as a pill for the ill and a diet for the disease. We don't want to do the same thing that the Western medicine does and treat symptoms. It's easy to fall into that. And it's easy to take an herb and treat a symptom, or do an acupuncture and treat a symptom, or do ozone and treat the symptom. But that's really not where the success comes. The success comes with identifying the root cause of the problem. And while you're treating the symptom, you're helping to fix the root cause of the problem. And when we can get that across to our owners, they are smart. They get that. And they really have a lot of confidence in you, and they trust us. And then ozone becomes a tool in the toolkit that helps us to get the animal where it needs to be so it has the longest, healthiest life possible.
And on that, I would, in my ideal world, I would have my patients come every 3 months and get a chiropractic adjustment, get acupuncture for their element, and ozone therapy so we can prevent problems. And that's kind of where we're headed, is getting into preventing them rather than treating them.
Yes. So whoever is thinking about coming into this, just know that yes, it's a wonderful tool for the symptom, but don't stop there. If you really want to see the magic of ozone, treat the underlying cause.
Yeah. Great. And that's like a paradigm shift that probably most of the holistic veterinarians at least have already gone down that rabbit hole a little bit, I would think. And it's just a matter of getting clients then to kind of come along on that trip.
They are much easier than the average veterinarian. They really are, because they're tired of failure. They're tired of seeing their animal get sick. And when you present the statistics of cancer, we had one gentleman recently, he brought his third dog to me, third dog that has cancer. And on his own, he said, what am I feeding, or what am I doing in my lifestyle that is causing this? Like, he took ownership, and he was feeding processed foods. So everybody went on our raw diet, and he started making the lifestyle changes, and he's willing and ready to do that. He just needed to be taught. And I think most of our owners are like that. It's not like we're asking them to do something that's so foreign. We're just saying, hey, if you're going to feed your animal, feed something healthy. If you're going to use water, feed a healthier water. If you're going to have a house environment, clean up some of the toxins. It's not that hard. They just don't know.
Okay, so as we kind of draw to a close tonight in the last few minutes here, kind of, if you would, talk to the veterinarian who's considering ozone therapy, your friend, maybe a colleague, who's looking at it and maybe, struggling with some of the concepts, doesn't know much about it, concerned that they can't really integrate it into their practice. Tell them why they, just help them work through a few of those roadblocks. And maybe you've had conversations with people already. Dr. Siegel, I know you've been working with it for a while now, but Dr. Carlson, kind of summarize some of this, that we've been talking about a little bit, if you can, and help wrap this up for this evening. Final thoughts and ideas.
Why wouldn't you? It's cheap. It's easy to learn. It's no adverse side effects. It's always helpful. And every cell in our body needs oxygen. And it can be delegated to your staff. I think those are the biggest reasons for me.
I ditto all of that. And I'm going to add the emotional part. which is every single veterinarian I've ever met. We go into our profession, we work our long hours, and we do that because we want to help. We want to make a difference. We want our patients to get better. And this is that tool above all others that helps us to move the needle in that direction. I'm not saying it's the only needle that you can move. It is a big part of it. And for that aspect, since that is really what we're trying to do, we're trying to do our very best for our patients. This is that very first step. You got to oxygenate them. You've got to reduce inflammation. That is absolutely imperative. And then, of course, Dr. Andrea already said, very inexpensive to get involved, extremely short learning curve, technician-driven skill. There's no reason why you wouldn't.
Good, great points. And I guess a fitting close to this evening. I will give you one more opportunity, though. Are there any final thoughts that you want to leave anybody with here this evening, or did we get everything in?
I'll do a shameless plug. I have just launched, I've just launched my training program, which is teaching veterinarians how to integrate alternative medicine into their practices. And the program is already launched. If anybody wants more information on how to do that, how to get involved and want to learn, it is a 5-level course. And we go through every modality step by step, starting with nutrition and all the way through the 6 steps to healing that I help to teach people and give away for free. And so the program is amazing, and ozone is our absolute first thing that we talk about.
That's awesome. And I've been hearing about this program, so it's exciting to see it launched and you getting going. And Marlene's a great teacher and instructor and just an encouraging person to be around. So I would highly recommend just learning from her and the years of experience that she's had. And I think that's a really needed thing too. I think that's a hard transition. It's got to be. I've never done it, but I would assume it's a really difficult transition to move because it's so overwhelming to look at all of what holistic medicine has to offer, alternatives or whatever you want to call it, and say, okay, that's huge. How do I integrate that? And the truth is, just like ozone, you don't integrate it all at once. So we don't start with every single administration method, on the first day. I'm sure it's little here, little there. You add to your toolbox little by little. But you start with ozone therapy.
Absolutely. And that's where I saw the 2 biggest holes that were in our industry. Number one, there was no alternative training. I mean, if you wanted to learn how to do acupuncture, you went to a school for acupuncture and then you got your herbal training. But no one taught how to put it all together. And so they were using their skill to treat a symptom, but they weren't learning how to incorporate all these tools in order to be able to diagnose and then to treat the root cause of the problem. And then the second thing that I found was that I'm doing coaching sessions for clients all over the United States and outside the United States. And I could tell them all these wonderful things that we were doing, and they had no access to them. So that's where we started launching the SPA's Family Wellness, which is our detoxification centers. So I'm just really filling a niche. And that would be my pearl. That would be my last pearl for a doctor, is that find what the world needs and then be the solution for that. It's really a lot of fun. It's very rewarding. It's what we came here to do. It's why we do the job that we do. And there's lots of support in order to be able to find what your niche is. I am a very eclectic individual, so I do it all. But you don't have to do it all. You have to find those things that you can fit in. What is it that your clients need in your community, or that you can serve your profession? And whatever that is, just be willing to step up and do it.
Great.
And that you said something that being a holistic veterinarian is so rewarding. When I come home, I'm not burnt out and upset that dog's needed more Apoquel because its allergies aren't getting better. I come home and I have successes, and that makes me feel good. I'm not depressed and I'm not anxious. I'm actually happy being a veterinarian.
Yeah. I'm 40 years in, and it's more fun now than it was in my first 5 years when I didn't have as many tools and I didn't know as much. I'm learning every day, and it's so rewarding.
That's great. Okay, so one last comment. We do have our ozone therapy forum. I think it's going to be on the 1st of October, the next one. So we're going to try to do monthly moderated conversation, veterinarians only, on that one. And it's all around ozone therapy. We're going to talk, I think, this next time about Prolo and ozone. But again, we will welcome any comments about anything ozone, even adding in how do we do it with other modalities and talk about that stuff. That's fine. So if you're a veterinarian, make sure you register for that. And if you haven't yet and you don't know how, just shoot us an email and I will make sure that we get you on that list and get you registered for that. And that's more of a everybody's talking type of thing. So it's interactive and we're all just in it together learning. So look forward to that on the 1st. I want to thank Dr. Carlson for being with us tonight. And thank you for all of the information that you provided to people who are, again, new to ozone therapy. And I think it's very valuable. This will be up on our YouTube site here probably tomorrow once we get it edited and ready. And then Dr. Siegel, thank you as well for being here. Both of you have been again, an encouragement to me. It's great to have veterinarians who are supportive and helpful and willing to help others. And so thank you.
And we look forward to seeing all of you in Florida. Or amazing
right.
Organic food and neat surroundings and great cases. And we're going to do large animal too. I've got 4 horses on property. So we're going to do large animals and small animals, and we'll try to find some exotics in there and a lot of hands-on.
Awesome. I'm looking forward to it. Thanks again. We will see you all next month.
Bye.
Bye.
Bye.